Hi, everyone. We are just about to get started here. All right. Again, hi, everyone. Welcome to Brain Awareness Week with the Society for Black Neuropsychology. I'm Day O'Shea, chair of the SBN Education Committee, and we're delighted to be bringing you a four-part series this week focusing on brain health across the lifespan. So, starting tonight through Thursday, we'll be having presentations on prenatal, children and brain health, midlife, and older adult populations. And I'm honored to introduce our first speaker tonight, our past SBN president, Dr. Courtney Ray, who will be talking about prenatal brain health. All right, take it away, Dr. Ray.
Hello, good evening, everyone. Thank you so much, Dr. O'Shea, for the invitation and the opportunity to come and to share with everyone tonight. I'm honored to be able to talk to you all about brain health. As Dr. O'Shea mentioned, I am a clinical neuropsychologist, and I work in New York City and also in northern New Jersey. So I am a clinical neuropsychologist, which means that I work with patients directly. Neuropsychologists study the brain and its mechanisms and the behaviors that those brain mechanisms actually are lending themselves to. And so you can do research in neuropsych and you can also see patients and test them to see how their brain works and how they individually are able to use the unique parts of their brains and the things that they're strong in and things that they might have challenges in. And I personally am a lifespan neuropsychologist, which means that I see people from very, very young ages all the way up to older ages, older adults as well. And that's why I am so happy to be able to talk about prenatal brain health, because I know that there are other people who specialize in other specific age groups, and they're going to be able to talk about those other age groups later on this week. I know that Dr. Sakina Butt is going to be here on Wednesday and at the same time. And we also will have Dr. Jeremy Grant, who will be here on Thursday, and he will be talking about brain health in middle age. Dr. Sakina Butt is going to be talking about pediatric brain health. Um, Dr. Grant is brain health in middle age. And then tomorrow we have Dr. Yinka Reed, who will be talking to us about brain health in older adults. And most of the time, when we think about brain health and when people start thinking about seeing a neuropsychologist, most of the time it's when people are older. So they might be having a little bit more difficulty with thinking and memory, and they might be a little bit slower in doing some of the things that they used to be doing. They might not be as quick as they used to be. And so sometimes people get concerned. And that's when they finally say, maybe I should see someone about this. And brain health becomes a priority. But older adults are going to be dealing with brain issues that are a culmination of all of the things that have happened to them throughout their entire lives, right? So it doesn't just start when you become a senior citizen or when you become someone who is in your golden twilight years of retirement, your brain health starts way younger. So if you are 80 years old, your brain health is the culmination of all the things that have happened to you and how you've taken care of your brain and all of the things that have had an effect on your brain, not only since your birth, but even before your birth. That's why it's so important for us to take brain health seriously, even when we're talking about prenatal brain health. And so that's what I'm going to be talking about today. This is going to be very introductory, and I hope that if this is something that you're actually familiar with and you know a lot about this subject, that you'll share it with somebody, share this video, share this link with someone who may not know as much as you do and who could learn something about prenatal health. Prenatal means before birth. Natal, if you've ever heard of the NICU, the neonatal intensive care unit, it's new natal, so born. So newborns are there in the NICU, and so prenatal is pre-born or before birth. And so prenatal brain health is about the brain developing before you're born. And I want to just give you guys some quick understanding about brain development, some facts, and hopefully dispel some myths. And if you are preparing to give birth anytime soon, or you know someone who is, hopefully you'll be able to give them some great information that will help them prepare for making sure that the baby that they will give birth to will have great brain health as far as possible. And so I want this to be interactive. I don't want this to just be me talking to you, but I actually want you to have some time to interact with me. So there is a quiz, and if Dr. O'Shea, if you can put that on the screen for us and share that on our screen. If you go to joinmyquiz.com and enter in game code 180515, you'll be able to join the quiz along with me. Now, this is for those who are watching live. If, of course, you're watching on the replay or you're not able to join in with us just now, that's perfectly okay, because there are no prizes. The only prize that you're going to have is your ability to say, hey, I knew some right answers. It's like when I watch Jeopardy. I'm not getting anything by screaming at my television set, but at least I have the ability to say that I knew a few things and I actually hopefully learned some things. And so we're going to ask you to participate as well. If you're not able to participate right this second, because you're either not watching the live or you are unable to get another device, again, that's absolutely fine. You could just go through it mentally with us as we're doing the quiz, okay? So it's joinmyquiz.com, and the game code is 180515, okay? And so as I'm waiting for people to come in and to enter, I just want to just quickly give you a few facts about brain health. One of those things is that when you have all of the systems that the baby is developing, you might think they all come at the same time or there's variation in some kind of a way. But actually, we know that systematically your brain develops in a certain different systems develop in at certain time periods, and the brain begins to develop at about 3 weeks and into gestation, and so that is pretty soon. But it doesn't finish very soon. There's a long way to go. We're talking about just very small things that are happening where we have neurons and glial cells migrating and during those first few weeks. But after a while, you'll see more and more proliferation, and babies still are developing even after birth. And so what I'm just going to go ahead and get started. And if you want to jump in later on, you can. Again, the code is 180515, joinmyquiz.com. And I'm going to start with the first question here. And hopefully you guys are able to join with us. So the first question, if I can, let's see if I can get this. So the first question is about whether or not you know when your brain it stops developing. So I said that brain development begins at about 3 weeks, right? So when does brain development end? When do we say that it's completed? Now, of course, we know that you learn something new every day, even in adulthood, right? And so we want to talk about not just, um, what we're not just saying that you don't learn anything anymore, but we're saying when does traditionally your brain reach sort of maturity? And so our question, our answers that you could have. I want to just call them out for you. So, if you know this, I want you to see if you're able to kind of figure out with the rest of the group. Again, that's joinmyquiz.com, and the code one more time is 180515. And so the first thing that we're going to ask you guys is, again, when does brain development end? When does brain development end? And so the answers that you get to choose from are um, is it at birth? Is it at toddlerhood? Is it at puberty? Or is it in your 20s? And a lot of people might wonder, which one is it? 20s, toddlerhood, puberty? I see a few people have answered already. All right. And the answer is you actually stop developing your brain in your 20s. It's amazing because a lot of us think that, once you're a child, maybe you're learning some things, and then maybe during puberty, you become, a little bit more mature. You're now a man or a woman, and so you're an adult, and so you believe that you don't have any more growing to do, any more development to do. But it's actually in your 20s, and we say that even at the age of 25 is about the time when we think that brain development kind of ends. And so that's why it's really, really important for people to take care of their brain health all the way through their developmental years. And so it doesn't just stop at the prenatal developmental period, but it goes all the way up through childhood, through adolescence, all the way up to the 20s. And so we want to make sure that you're doing all those things to help along the way, making sure your brain is developing well. Next question. When we're talking about things that you can do to make sure that your baby is growing healthfully, and because we want to make sure that that brain development is doing the best we can, and nurturing that the best we can, we want to know what kind of things we should put into our bodies if you're pregnant, or before you get pregnant. What are some of the things that you should put on your body? So which one of these vitamin groups is especially important for brain health and development? Which of these vitamin groups is especially important for brain health and development? Vitamin A, vitamin B, vitamin C, or vitamin D? So vitamin A, vitamin D, B, C, or D. Now, we know all vitamins are important, and prenatal vitamins are good for you even if you are not pregnant right now. Having prenatal vitamins is actually good to make sure that you're just healthy in your own body. And actually, even if you're not planning on getting pregnant, it's good for your hair, your nails, and your skin. Those vitamins are great. But which is important specifically for prenatal brain health? A, B, C, or D? And the answer is vitamin B. The vitamin B complex, particularly folic acid, is really crucial for brain health and development. And so we want to make sure that you are getting your prenatal vitamins as much as possible. Folic acid specifically is great for brain development. And we want to make sure that you're doing everything that your doctor prescribes you to do. But prenatal vitamins is something that is good even before you become pregnant. Next question um, is reading to your baby uh, going to make your baby smarter? Is reading to your baby in the womb going to make your baby smarter? If you guys have ever seen Mr. Holland's Opus, you probably have seen that one scene where they put the headphones on the mom's stomach while she's pregnant so that she can listen to the music. And so, because Mr. Holland is very a musical guy, and he wants the child to get some musical appreciation. So he wants the kid to hear the music in the womb. And so a lot of people also think that if you read to the child in the womb, you'll be able to make your child more intelligent. Is that true? Is there any kind of benefit to that? And the answer is actually false. Now, I'm not saying that it's bad to read to your baby in the womb. I'm not saying that, but I am saying that there's no concrete evidence that it actually makes your baby smarter. So you can do it. I think that it's great for your bonding and allowing you to grow more comfortable and really get into the mode of parenthood, but there's no proven truth to reading in the womb will make your baby smarter. Speaking of senses in the womb, at what age or at what trimester, sorry, do babies begin having the sense of smell? So in the womb, in the trimester, first trimester, second trimester, third trimester, or maybe babies don't develop a sense of smell in the womb at all. Maybe there is no prenatal sense of smell. So do you think that that develops in first, second, third, or not at all? Which trimester there? Is it something that prenatally fetuses can smell or not? Let's see, I'm waiting for some people. And the answer is third trimester. The third trimester is when your prenatal development is allowing your brain to have the functioning for smell, also hearing. So if you're reading to the baby before the third trimester, you're not hearing anything anywhere, and also the sense of touch. So touch, smell, and hearing develop about the 28th week, which is the third trimester. And so if you have a desire to talk to your baby during that time, they actually do learn your voice and learn to respond to your voice. And so there is some truth to that part, at least, that there is a response to your voice. It's not necessarily that reading is going to make them smarter, but they will have a response to your voice. Next question. Speaking of things that we should do for development, and also things that we shouldn't do for healthy brain development, true or false, fish is bad for the developing fetus. Fish is bad. So it's bad to eat fish if you're pregnant because it's going to have a detrimental effect on the baby. And your options are true, false, or it depends. True, false, or it depends. Fish is bad for the developing fetus. So I know that a lot of people, when you get pregnant, everybody comes out the woodwork to give you great advice about what they did and what you should do or what's important. So when it comes to eating fish, bad or good, some people will tell you not to eat it at all. Some people will say it's great for you. True, false, or it depends. And the answer is it depends. You can eat cooked fish that is low in mercury and that is high in omega-3 fatty acids. And that is actually very helpful for fetal brain development. Raw fish and undercooked fish is not very healthy, and fishes that have mercury are also detrimental to fetal brain development. And so we want to stay away from those kinds of things. But fish that is low in mercury, fish that is cooked, and fish that is high in omega-3 fatty acids is actually healthy for you. Um, Next thing, something else that you should avoid. We know that smoking is bad for you. So, true or false? Once someone who is a smoker finds out that they're pregnant, the best thing they should do is to quit cold turkey. True or false? Once somebody who is pregnant finds out that they, or somebody who is a smoker finds out that they are pregnant, the best thing they could do is to quit immediately cold turkey. True or false? Now, we all know that smoking is not great for fetal development. It is absolutely something that we know is damaging to brain development and also other development of other body systems for the baby. So we want to not expose the baby to the harmful chemicals that are in cigarettes. And so if you are a smoker and you're a heavy smoker, should you stop cold turkey? And the answer actually is false. Because when we say cold turkey, that means with no preparation and immediately and just by yourself. And that's not the best way to do things, even if, especially if you are a heavy smoker, because if you don't have a plan, if you're not working towards gradually stepping down, if you do something, if you are highly dependent on cigarettes and highly dependent on any substance, and then you just quit cold turkey with no plan, it's very easy to, number one, go through very strong withdrawals. And number two, it's very easy to relapse as well. And so it's really important that you consult with your physician and get a plan. Also, talk to a health psychologist. There are people who are psychologists who specialize in helping people to develop healthy behaviors. And so if you're someone who needs some help in quitting a dangerous behavior or quitting an unhealthy behavior, then you are eligible and you really should seek the advice of a health psychologist to learn how to make those changes that will help you to be a better person, healthfully for yourself and also for your unborn baby. So making sure that you develop a plan with someone, that is the absolute best course. Next question. If you think that if you have already been smoking for a very long time and you find out late in your pregnancy that you are pregnant, you might as well continue to smoke. True or false? So if you've been smoking for a very long time and you find out very late in your pregnancy that you're pregnant, you might as well just keep going. True or false? And like we said, smoking is dangerous. The best thing to do is just not to start at all. There's so many health effects of smoking. And if you want to quit smoking, there's so many resources that are available. But the question is, if you've already been smoking this whole time and it's late in your pregnancy, should you go ahead and keep doing it? You should not keep smoking. So that is false. At any stage of development, you can cause damage if you are continuing to introduce all of the chemicals in cigarettes to your unborn fetus. And so at any point that you quit, that is healthy for you and for the developing fetus. To stop and to make sure that you're stopping in a good way is important. And it's also responsible because it deprives your unborn baby of oxygen. And that also obviously has an effect on brain development as well as lung development, also low birth weight, all of these different things. And so we want to make sure that we're doing everything we can. And so even if it's in your third trimester that you find out and you're trying to quit smoking, try to do that, because it's going to be beneficial for every day that your baby is able to develop without being subjected to cigarettes. Okay. All right. Another wives' tale that we often will hear is that exercise is bad. Like, you should definitely sit and rest and just chill out during your pregnancy. And so I want to know, is that true? If you are an otherwise healthy person who exercises daily and you find out that you're pregnant, should you stop? True or false? you should stop exercising when you find out that you're pregnant. Taking it easy, making sure that you're relaxed, those kinds of things. Is that good for your baby? True or false? And the answer to that is false. You should not stop exercising if you are already a healthy exerciser and a regular exerciser and you don't have any other complications that are going on with your pregnancy. I've seen people who are bodybuilders, who are regular athletes, who are still making sure that they keep up with their exercise regimen even while they're pregnant. Serena Williams famously won one of the Grand Slams as she was pregnant with her daughter Alexis. And so we know that you can be an athlete and also make sure that you have a healthy, happy baby. And so exercise is not bad. It is actually beneficial for your baby's development. And last thing, true or false, stress can have a negative effect on the baby's development, on prenatal brain development. Stress can have an effect. So if you're stressing mama out, is that going to affect adversely the baby in some way? True or false? And the answer to that is actually true. We do know that um, through lots of tests that we've had with animal testing, and then even when we've seen people who've been through very stressful environments, really traumatic situations, natural disasters, abusive situations, that those stressors have an impact not only on the well-being and mental health of the one who's pregnant, but also on the developing fetus as well. And excessive prenatal stress can actually contribute to underdevelopment of important brain structures that are important for memory, attention, and for all other types of processes. So you want to make sure that you're not having excessively stressful situations that you're constantly being exposed to if you're pregnant, because that can actually be detrimental to your baby's developing brain health. So, how did you do? I don't know if you got all those right, or if you kind of were unsure about a few of those questions, or maybe you learned something new that you hadn't learned before. But it's really important that no matter what stage of pregnancy, the first, second, or third trimester, that you're doing what you can to make sure that you are incorporating healthy habits and practices so that it can contribute to good prenatal health. That means getting well checkups, that prenatal visits. And unfortunately, for many people who are in the Black community, a lot of people are getting inadequate prenatal care, inadequate checkups. And part of that is because of access. Part of that is because of not really knowing all of the steps that are important. But also, we know that there are some people who have had really bad experiences with medical professionals, and there might be some distrust there. Even I mentioned Serena Williams earlier. She was talking about how she had a very negative experience, and in her own, even though she's wealthy, even though she's a celebrity, even though she's very educated, all of these things, she had no problem with access. She had no problem with funding herself. It was very difficult for her to get her voice heard when she had concerns about giving birth. And so it's really important that you find a OBGYN who listens to your concerns, who hears what you have to say, and is willing to really give a lot of attention to the things that you have thoughts about, things that are concerning to you, and who listens to you and makes sure that they are doing what they can to give you the best care possible. If you don't have good insurance, there are governmental programs that can help you if you're pregnant, because it is in the best interest of our collective public health to make sure that our babies and our children are healthy and strong, and that starts with good prenatal care. And so there are lots of opportunities for you to be able to get prenatal care through government programs as well, even if you don't have a regular OBGYN or you don't have regular insurance. And so I want to encourage you, if you or someone you know is pregnant, to go to a center, go to a government office and find out more information about what is available in your state, and also lots of federal programs. Planned Parenthood, lots of people don't know. They also, in addition to all the other things they do, they also give prenatal care, and they give checkups to those who are pregnant. Getting regular scans is important too. And one of the things, here's another true or false. If somebody is, if it's revealed that the baby has not normal development, does that mean that they will be doomed to a life of poor quality of life? And many people think that, and that fear often will keep people from wanting to get regular checkups, because the thought is, well, if I don't know what's wrong or if something's wrong, then I just don't have to deal with it. And it's very scary because there's nothing that I can do if there's something wrong. But, it's a myth that a baby that has abnormal development is doomed to a life that has poor quality of life. There's lots of things that can be done. Not every abnormal development condition is one that leads to very drastic changes. And even in those cases, there are ways that we can help give accommodations. And it's better for you to know about those situations and options earlier on than later on, because the earlier different things are detected, the more options you have, the more you will be able to be prepared for decisions that you can make in the future. And your doctor will be able to guide you towards what is better for you and what you can anticipate as a result of different conditions. And so what we do as neuropsychologists, we don't do a lot when the baby is still in the womb. Usually it's just scans and different things like that that are detecting any kind of brain development issues. But if we know that there are brain development issues that are going on, and the baby has, after you have your child, we're able to help you to understand what are some of the options that you have. And so I don't want anyone to be afraid of going to get well baby check or prenatal checkups, because those are really, really important. And even if you think that something might not be quite right, there are people willing and ready to help you. And there are so many things. I hope that just in the short time of doing these kind of little questions and answers, you got a chance to sort of think about all of the different kinds of things that you can do to help positively contribute to prenatal brain health, so that to the best of your ability, you're able to give your child a great head start even before they're born. So that is kind of the end of my little spiel. I hope that you've learned something. I don't know if there are any or questions, and I actually do see that there are a few questions. Oh, so.
Yep, I'm happy to read them out for
Sure.
you, Dr. Ray, and thank you so much for that fantastic talk, just jam-packed with tips on brain health. So we do have a couple of questions here from the audience. So one says, never thought about brain health being assessed prenatal. How is the brain assessed in utero? What are the different techniques, or how can we get an understanding of the developing brain?
Yeah. And so, great question. So, ultrasounds are obviously the least invasive way to test if there's healthy development happening. And so, when you go in for prenatal visits, your physician will do scans regularly to check the brain size and also brain structure against what should be what we would call normal development, and sort of see at this stage the baby's brain should be at this size. There's also the ability to look and see CT scans as well to see whether or not there are any structures that in the brain that are not necessarily developing correctly. Um, Sometimes the brain, your brain and your spinal cord are bathed in what we call cerebral spinal fluid, and so it's supposed to be on the outside sort of part of your brain, and the outside of your spine. And sometimes what we'll see is what we call hydrocephalus, which is called water on the brain, but it's not really water. It's cerebral spinal fluid, and it takes up more space than it should. And so you'll see sometimes the brain is not developing in the way that it should, and where there should be brain tissue, instead it'll look on a scan like it's sort of a void. So you'll see where there's fluid there, where brain matter should be. Sometimes it's not that obvious when there are different conditions of the brain. There might be some things that are very small, minute changes. Things like, I'm just kind of blanking a little bit. When you have, hemiplasia, when you have like half of the brain is not able to be fully developed, that's also a pretty big thing. But there are also other milder things. Cystic fibrosis is also something that we know is a developmental issue of the CNS, but there's a wide spectrum of people who have challenges in different ways. And so your physician is just looking to see what are the things that they can tell on those scans. But unless it's something like very large, exceptionally, glaring, usually you're not able to tell like exactly how the baby will function until after they have been born. But it's really important to know that, because if there are things that are very significant, you want to be prepared for that. You want to understand that, and you want to make sure that you recognize what those challenges might be and what accommodations you might want to consider. Also, genetic testing is another thing. There are certain abnormalities that are genetically linked, and so being able to do that kind of testing and see if there are any issues in terms of chromosomes or issues in terms of genetics, and being able to say, well, we know that this particular genetic combination leads to this specific disorder, and knowing what those challenges are, because we know people who have these different kinds of challenges when they have this specific genome. So those are some of the ways that you can assess brain health even before birth.
Great. And we do have another question. You mentioned about mercury and fish earlier. We have a question asking, are there other overlooked environmental toxins that should be avoided while pregnant?
A lot, a lot. So I talked already about smoking and cigarettes, right? And so it's not just if you are a smoker yourself, but secondhand smoke can actually also have some detrimental effects as well, not only for your own lungs, but also for the developing fetus. You want to make sure that it's very interesting that there are lots of people who don't recognize or really pay attention to the health of or the plumbing situation in their homes. And if you're in an older home, or if you're in a very rural area, you should pay attention to that, because there might be different things, metals in your pipes that might contribute to abnormal brain development, like lead. Many places have modernized and made sure that there's no lead in pipes anymore, and any new constructions are not allowed to have lead paint. And so if you're in a new construction, you're pretty safe from that. But if you're in an older place, in a rural place, in a place that hasn't been refurbished in many years, then it's really important to know and check those things environmentally in the home that you stay in. I lived in California for a while, and it's very interesting. If you go any place in California, there's all these signs all over the place that say there are chemicals in this paint and chemicals in this drink and chemicals in this facility. All of these things can contribute to abnormal brain development in the developing fetus, and so pregnant women need to beware. And so it is true that there are lots of things in the environment that can have an adverse effect, but also we don't want to be super paranoid and we don't want to just continually feel like we can't go out or be in anybody's space because there are so many different factors. Live your life, but make sure that you're keeping away from things like mercury, things like lead, any heavy metals, basically. And also cigarettes, alcohol as well, any illicit drugs, even some drugs that you might be prescribed. And this is really important as well. You want to talk to your physician about whether or not it's safe to continue those drugs while you're pregnant, because some drugs have an adverse effect on the developing fetus as well. And so you want to make sure that you're having that conversation with your doctor. Don't just go cold turkey off your medications. Your doctor might prescribe a different medication that does the same thing, but is proven okay for pregnant individuals to take, or they might say, it's okay for you to take this and it's not going to be any trouble. Or they might say, what, the benefits of you getting off of it are not as great as you staying on it. So just go ahead and stay on it. So make sure that you are having those conversations about your own prescription medications, which are great things for you to make sure you're taking care of yourself, but make sure that they're cleared by your physician to continue using when you're pregnant.
Great. Thank you so much. Those are our final questions for this evening. Again, appreciate you being here. So much knowledge, so many actionable tips for us to better understand brain health and the developing brain prenatally. So I do want to, again, highlight that we have our series this week for brain awareness, and we'll be continuing tomorrow night, same place, 7:30, with Dr. Yinka Reed, who will be talking about brain health in older adults. So we'll be looking at the other end of the lifespan. It's so important to be prepared and be knowledgeable about brain health, prevention, and wellness in aging and older adults as well. So be ready for another great talk.
All right. Have a good night. Thank you.
Okay, thanks everyone. Thanks for joining us.